Welcome back. It's Dr. Jen Fruboni, Doctor of Physical Therapy, better known as DocJenFit, owner and founder of Gen Health, your one-stop place for all things aches, pains, or just wanting to feel good within your body. Now, today we're going to talk about core bracing. Now, especially during pregnancy, this can feel like, what am I supposed to do? And I've also gotten questions, and you can let me know in the comments if this is something you've wondered about as well. You know, is it bad for baby if I'm going to contract my stomach? Because I've heard from people, and I get these questions that, aren't I squeezing my baby if I'm contracting my core? And what I say is that your baby is so protected in the uterus. It is totally fine and natural, normal that we're still going to use our core muscles, even though they're getting stretched. So we have to use them in a different way, in a different capacity. But understanding how you brace your core is so incredibly important, because as our pressure is distributed differently as the belly stretches and these ab muscles get separated, which is normal during pregnancy, we have to make sure that we understand how to maximize how we use and brace our core so that we reduce symptoms going down to the pelvic floor, like leaking or when you're sneezing, when you're coughing. Your core is already going to be contracting during these times. So understanding how to control and brace it even better during pregnancy is only going to help you to feel better. Now, I also just want to say that the pelvic floor, like I mentioned, is so integrated into our core. Though we're going to touch on the pelvic floor a little bit, it is so integrated into our core. And I want you to know that I have a pelvic floor foundations course available, and you can have this course for life and even have a discount code. You can use code OPTIMAL10 and you get a little discount on this as well. However, this course you get to keep for life, and you really get to understand how to utilize your core even throughout pregnancy and beyond. So we're going to touch on it, but know that that's available. I'll have that linked up. Again, code OPTIMAL10 gets you a discount if you want to dive in further to understanding how pelvic floor foundations really helps to create that stability and awareness within the whole body. Now, when it comes to core bracing, one thing that we want to look out for is core coning. So this is where we're doing something, we're doing an exercise, and as we're doing it, we notice that there's just like a point that starts to happen, and we're getting a lot of pressure out in just the middle part of your core. A lot of times you'll see this during core exercises, but it can also happen during side planks, Copenhagen planks, anything when you're hanging on a bar, so pull-ups or leg lifts, any kind of core exercise on your back. Or you might even notice it when you do sneeze and when you do laugh and when you do other things. So we want to start to look out for those signs of coning. Okay. And again, what that's really going to look like, and one of the easiest ways to kind of check for it, if I don't control my core at all and I just lean back, I get this like really steep kind of like tipping effect happening right into my belly. And that's where I'm getting a lot of excess pressure already out into my midline of my belly, called my linea alba, where my rectus abdominis muscles connect. Now, we already have a lot of pressure going out there. We already developed diastasis recti during pregnancy, which for most people, it goes away after. But we don't want to stress it even more. So if we can help to control it, seeing it every once in a while, it's okay. But if we can help to control it, that's what we want to do. So that's what we're going to talk about today. Now, let me know if you have any comments or questions about coning in the comments, and let me know if you've noticed this. Like maybe you're going from bed and you're sitting up and you notice every time that your stomach kind of comes to this point. My recommendation for that, roll to your side and then sit up so that you don't have to worry about that at all. But when are you seeing it? Have you noticed it? Let me know in the comments. Now, when we're talking about bracing, one of the easiest ways to get started is just in a seated position. So what you're going to do is you're going to try to think of breathing from the sides of your rib cage. So let's just practice that. So put your thumbs kind of on the sides of the rib cage so that you can feel the rib cage. So you should feel bone. And then you're going to breathe into your thumb. So breathe in here. And then relax that breath. Again, breathe in and relax. For so many of us, because that diaphragm is getting flattened, we lose that access to really take a really good effective breath. And we end up breathing up into our shoulders, which we don't want, or sucking in the belly as we're breathing in. You want the belly to completely relax. So the belly, diaphragmatic breath is not a belly breath. It's not a pushing out of the belly. It's actually a breath around where the diaphragm is, which is around that low rib cage. So again, I would breathe in. Now on the exhale, I want you to think of blowing out through a straw really slowly. On this exhale, I want you to think of that pelvic floor slightly lifting up, and you're going to think of the lower abdominal region lifting and hugging in your baby. So it's going to be, again, a very slight lift of the pelvic floor. If you don't feel that at all, that's okay. We're just thinking of that exhale coming down from that pelvic floor and then wrapping up and in. So almost like your body is hugging into that baby and it's lifting up and hugging as you do that. Okay, so we're going, everything is low to high. So again, I'm going to breathe in from my rib cage, breathe out from a straw. Can you hold that? Breathe in from that rib cage, breathe out from that straw. And then completely relax. And you should notice a difference. Like this is even first trimester, second trimester, you should start to notice a difference from that belly. So again, breathing in, breathing out low. Hold it. Breathe in, breathe out, and relax. A really good way to kind of feel this is especially when you're in a little bit heavier of a breathing. So maybe you've gone for a walk, a hike, you're doing a workout between your workout sets, or take a break on your walk or hike when you already are kind of like breathing a little bit harder. Take a seat and feel this difference because you should really feel it. Take a breath in from that rib cage. Breathe out low. Relax it out. Breathe in. And you should feel that difference in that relaxation and that contraction. And again, it's not that I'm trying to suck my belly in at all, or I'm trying to grip down from my rib cage so my upper body isn't moving at all. It's all happening low to high, right? So it's all coming from that low to help support and wrap low. That's what we want. We want that transverse abdominis and that pelvic floor to kind of work together with those obliques to kind of help support the belly area. Okay, so that's the brace. And you can hold that brace as we demonstrated by contracting still breathing in from that rib cage, but holding that contraction. And this is how we then start to use it through movement and exercise. So I want to just show you an example. If I come onto all fours here, okay, and we can practice here. So breathing in, relaxing around that rib cage and belly, breathe out, go from low, from that pelvic floor area. Again, breathe in, hold that. Breathe out. And then completely relax it. Breathe out. What you notice here is that hopefully you're noticing that my spine isn't moving. So as I breathe out, I'm not rounding. Okay. Again, we don't want this force to come up from this upper ab area. We don't want to be upper gripping. So it's just a breath in. Breath out. You can completely relax again. And breath out. Low to wrap up. Okay. And this is going to take practice, especially if you've never done it before. Let's try it in standing and I'll show you what it looks like to go through a squat with it. Now in standing for a squat, you're going to be thinking of, again, use that same breath pattern prior to going into the squat. So we're going to take a breath in from the rib cage. Now practice that low to high. Go into the squat. Keep exhaling. Now what you can do, you can inhale, come down, exhale before you, and then come back up. But a lot of times when we're just practicing this, it's good to exhale throughout the entire movement. So a breath in, exhale. and you get that full support as you're going into the squat. So especially during exercise and movement, if you've been feeling symptoms of leaking or a loss of control of your pelvic floor, this is a good way to help to contract that pelvic floor with the core, is that we're going to be exhaling throughout the entirety of the movement. Remember, blowing through a straw, wrapping low to high, and practicing that engagement. I hope that helps. If you notice signs of coning, don't freak out about it, but just see, how can I modify this? How can I use that core contraction? Don't forget, if you love what you're learning, I have so much more in stock for you. So hit that subscribe button, check out the other videos I've done in the past, and leave any comments of any suggestions that you have for videos in the future. And I can't wait to help you feel incredible and amazing within your body.